An important part of creating a safe return to campus is ensuring that our campus community is knowledgeable about COVID-19 and the strategies to prevent the spread of disease, both those that the college has implemented and those that are the responsibility of every member of our community. All of us, students, staff, and faculty, will be required to complete this educational module before returning to campus. In this course, we'll provide an overview of COVID-19, the prevention strategies that we are implementing, information about what to do should you become sick or exposed to COVID, information about caring for yourself more holistically with an emphasis on caring for your mental health, an overview of our campus commitment, and the resources that you'll need as we return to campus. It's important to note that this pandemic is evolving. Since January 2020, we have seen the knowledge base and recommendations change on an almost daily basis, and we anticipate that our understanding of this virus and how best to prevent its spread will continue to change. This course has been developed based on the current information regarding best practices obtained from guidance and publications issued by the U.S. Centers for Disease Control and Prevention, the American College Health Association, the Johns Hopkins Bloomberg School of Public Health, and other federal, state, and local public health officials. Coronaviruses are a large group of viruses that cause diseases in animals and humans. The name comes from the shape of the virus, which looks like a crown or corona. In humans, the viruses can cause respiratory infections with a range of symptoms from mild, like the common cold, to more serious illnesses like pneumonia. COVID-19 is the disease caused by the new coronavirus that emerged in China in December 2019. It spread fairly rapidly worldwide and was classified as a pandemic by the World Health Organization in March of 2020. COVID is transmitted via droplets emitted when people cough or sneeze. These droplets do not linger in the air or travel very far. That's why strategies like wearing masks and social distance are key prevention strategies. There is also evidence to suggest that the virus can spread in the air through much tinier particles that are suspended in the air. Particle transmission like this is of particular concern in enclosed and crowded spaces. That's why limits on the number of people in spaces, as well as ensuring good ventilation, is a key prevention strategy. As just noticed, droplets emitted when coughing, sneezing, or talking don't hang in the air very long, so they can fall onto objects. People can also contaminate surfaces with their hands after touching their faces, tissues, or other contaminated objects. This is why hygiene practices like hand washing, avoiding touching your face, and frequently cleaning high-touch surfaces are key prevention measures. Let's take a look at the timeline of infection. At day 0 on this timeline, our blue person is infected through exposure to the droplets emitted by a person who's ill with COVID-19. The incubation period for the virus is between 2 and 14 days. This means that a person could develop symptoms anytime between 2 and 14 days after being exposed to the virus. In our example, our blue person develops symptoms at day 14. For someone who develops mild illness, their symptoms are likely to last for about 10 days. For someone who develops more serious or severe illness, symptoms might last for more than 2 weeks. People are most infectious on the day that they develop symptoms, but they actually become infectious 2 days prior to the development of symptoms. And contagion lessens with time. As symptoms improve, we become less contagious. If our blue patient is in close contact with another person during their infectious period, they can spread the illness to that person. Let's say that on day 13, before blue person's symptoms emerge, our blue patient spends time with our purple person. Because blue person's symptoms began 2 days before they showed up, before symptoms showed up, they exposed purple to COVID-19. Purple begins their incubation period on day 13 and begins to show symptoms on day 18, 5 days after exposure. Our purple person becomes infectious 2 days prior to the onset of their symptoms on day 16. This means that after our blue person becomes symptomatic, there is a window of opportunity to try to keep purple from spreading the virus, the time it takes between exposure and infectiousness. This is why isolation and contact tracing are incredibly important parts of reducing the spread of COVID-19. If blue self-isolates and lets public health authorities know that they are showing signs of illness, contact tracers will get in touch with whomever blue had contact with during their infectious period and ask those people, purple in this case, to quarantine so that they will not spread the virus to others. This diagram shows how quickly a virus like COVID can spread through a population. By preventing someone who's been exposed to COVID from transmitting the virus to just one person, one less person of exposure, isolation, contact tracing, and quarantine can lead to very large reductions in cases over time. Hopefully, you can see why being attentive to your own physical well-being and being responsive to any symptoms is incredibly important to our efforts to reduce the spread of the virus. Therefore, all community members will be asked to complete a daily screening before leaving your residences to move about campus. This screening is housed in the Colorado College app, which you can download from the Apple or Google App Stores. Once you've installed the app on your phone, you can access the screener by clicking the COVID check button. You'll then be asked some questions about your temperature and symptoms. Our standard for a fever is if your temperature is 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, or if your temperature is more than 1.8 degrees Fahrenheit above your normal baseline temperature. If you don't have fever or symptoms, you'll be given a cleared for entry screen. You can then proceed as normal through your day. You may be asked to show this screen when going to class, a dining facility, or other offices on campus. If you do have a temperature or endorsed symptoms, you'll be given an entry denied screen. You should stay home and contact a medical provider to see if you need to be tested for COVID. Let's talk a little bit more about symptoms. Remember, anyone can have mild to severe symptoms. Older adults and people who have severe underlying medical conditions like heart or lung disease or diabetes seem to be at higher risk for developing more serious complications from COVID illness. People with COVID-19 have had a wide range of symptoms, ranging from mild symptoms to severe illness. And remember, those symptoms may appear 2 to 14 days after exposure to the virus. Some symptoms are more well-known than others, like a fever and a cough or shortness of breath. But other common symptoms include fatigue, muscle or body aches, headache, a new loss of taste or smell, a sore throat, new congestion or runny nose that's not part of seasonal allergies, nausea or vomiting, and diarrhea. If someone is showing any of these signs, trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake or stay awake, bluish lips or face, seek emergency medical care immediately. Remember, if you're not feeling well, please stay home. Self-isolation helps reduce transmission of illness. If you are sick and/or think that you've been exposed to COVID-19, call your healthcare provider to discuss your symptoms and get advice about whether you need to get tested. During their hours of operation, students can call the Student Health Center, and staff and faculty should utilize the nurse triage line, which will be available through the UC Health app, which I'll talk to you about in just a moment. After hours, everyone on campus can call that UC Health nurse triage line to arrange for testing. Inform campus safety if you're notified that you've been exposed to a positive COVID-19 case. Also contact your supervisor if you're an employee of the college. And again, if you experience any of those symptoms like trouble breathing, pain or pressure in the chest, confusion, blueness in the lips or face, and difficulty staying awake, seek emergency medical attention. Always call your doctor or emergency room before going so that they can be best prepared to help you when you arrive. In addition to being attentive to any symptoms through the daily screening, there are a number of personal hygiene and other prevention steps that you'll be required to carry out when you return to campus. Practicing hand hygiene, wearing masks, and following social distancing guidelines are simple yet effective ways to prevent the spread of COVID. Additionally, as you're moving about common areas, try to only touch surfaces you need to touch and use disinfecting wipes after you use common areas like lounges, residence hall bathrooms, and kitchens. Alcohol-based wipes or sprays containing at least 70% alcohol are recommended, and these will be supplied in common areas. As a reminder, it's the best practice to wash your hands frequently with soap and running water. Wet and lather, then scrub for at least 20 seconds before rinsing well under running water. If you don't have access to soap and running water, you can use a liquid hand sanitizer that contains at least 60% alcohol. Wearing masks is now a key part of preventing the spread of COVID in communities. As you're probably aware, wearing a mask primarily protects the people around you. So wearing masks at CC is an important part of the way we can show our care for one another. Students are required to wear masks outside of their bedroom if living in the large halls and small houses, and outside of apartments if living in campus apartments. Staff and faculty are required to wear masks whenever they are on campus, unless they are by themselves in a private office with the door closed. In order for masks to be effective, they need to fit snugly against the sides of your face and completely cover your nose and mouth. Always wash or disinfect your hands before putting a mask on, and don't touch the mask once it's on your face. If you do touch it, be sure to wash or disinfect your hands. Once on your face, your mask should stay there until you're ready to remove it, to eat, or because you're back in your home. When you get home, take off your cloth face covering carefully by untying the strings behind your head or stretching the ear loops. You should only handle your mask by the loops or ties. Once off your face, fold the outside corners of your mask together and place it in the washing machine or into a plastic bag to take to the laundry room. Be careful not to touch your eyes, nose, and mouth, and wash your hands immediately after removing your mask. Due to the way the COVID virus is transmitted, social distancing is another key part of preventing illness. Public health authorities recommend that you limit close contact, which is less than 6 feet of distance, for more than 15 minutes at a time, that you limit close contact to people within your circle of 10. For many people across the US, this circle is their family unit. Here on campus, it might be your quarantine, pod, or bubble. As you think about forming your circle of 10, be sure to include anyone that you would come into regular contact with and the people you live with. For students, your roommates will be part of your circle. If you add people outside of your household or living unit to your social circle, be sure to include anyone in their households as well. You may not see them often, but they would still be considered part of your circle of 10. So if your roommate has a partner with whom they spend a lot of time, that partner is part of your social circle. And that partner's roommate would also be a part of your social circle. As you think about the way that your social circle can expand based on close contacts of the people you spend time with, it would be easy to reach 10 people. Open communications and thoughtful consideration is required for creating your quarantine. You must stay at least 6 feet away from all other people, and no student gatherings greater than 10 people will be allowed, whether on or off campus. So those are the things that we're asking every member of our community to do. There are also a number of prevention strategies that the college is implementing, including density reduction and social distancing. As many of you are aware, we've expanded our housing stock to include some apartment style living about 6 miles away from campus, and that reduces the density of our on-campus housing. No visitors will be allowed on campus during the fall semester. We've also reduced the capacity of public and common spaces around campus. You'll notice fewer chairs and some seating spaces that are marked "Do Not Sit." Classrooms have been set up for social distance, and we'll have smaller, socially distanced events of 10 or fewer people. New directional traffic flows in, through, and out of many buildings have been implemented. And you'll also see social distance markings on floors where lines or queues might be likely to form. We've changed our food service delivery model with multiple venues for food pickup, but no self-serve food. We've enhanced cleaning throughout campus with special focus on high-touch areas. Hand sanitizer stations and screens have been installed at service desks, and a systematic evaluation of building ventilation throughout campus has been conducted. The college has also developed strategies for testing. Testing is an important part of the public health response to COVID, and we want to reduce any barriers to testing for our community. Through partnerships with UC Health and Optum, on-campus testing for any member of our campus community who experiences symptoms of COVID-19 will be available. We encourage you to go ahead and download the UC Health My Connection app, available from Apple and Google App Stores. Through that app, you'll be able to access a nurse triage line, schedule testing appointments, and get your test results. When you log into the app, you'll also be asked to sign a release to allow COVID test results to be shared with the CC contact tracing team. These results will only be used for contact tracing, isolation, and quarantine processes. Beginning August 5th, all students on campus will be tested for COVID-19. You'll be receiving more information about the logistics of testing days. We've also developed an ongoing testing strategy based on science and medical expert advice. As I mentioned earlier, contact tracing, the process of identifying close contacts of positive COVID cases and implementing quarantine to limit the spread of the virus, has been a key part of reducing spread of COVID around the globe. CC has identified a lead contact tracer who will supervise a team of campus tracers working in collaboration with the El Paso County Department of Health. Anyone who tests positive for COVID-19 would be isolated for at least 10 days and until symptoms clear. And contact tracing would identify people who may have been exposed to COVID-19 positive patients and would need to be quarantined for 14 days from last date of exposure. We've identified isolation and quarantine spaces where any student in residence can be moved. People in isolation or quarantine will receive daily contact from the contact tracing team to check in regarding symptoms, medical needs, mental health status and needs, and academic or work needs. For on-campus students, we will deliver food and ensure that the students have access to medical care and other needed services. We can also assist off-campus students with food delivery from grocery stores. Although much of the conversation about COVID, and admittedly most of this module, focus on the virus itself, we recognize how important it is to care for our whole selves, and in particular to care for our mental health. The disruptions caused by COVID take a toll on our mental well-being. Common reactions include anxiety, worry, feelings of helplessness or anger, difficulty concentrating, difficulty sleeping, social withdrawal, and hypervigilance to your body and health. We often think of mental health as only being relevant when someone's having a hard time, but we can all engage supports and resources along the entire spectrum of well-being. This stepped care model allows us to better match services and supports, both clinical and non-clinical, to the needs and goals of individual students. The spectrum of mental health supports at CC include self-help resources, emotional wellness and spiritual life workshops and programs in which students can develop skills and practices that help them manage their emotional well-being. Things that all students or all people might be engaged in. There are also peer supports and problem-focused consultation and counseling sessions, individual and group psychotherapy, and medication management. There are also a spectrum of supports for staff and faculty. Many of the workshops and programs available through offices like the Wellness Resource Center, Chaplain's Office, Fine Arts Center, and Creativity and Innovation are also open to employees of the college. And there are services like Employee Assistant Program, or EAP, available for staff needing counseling. Being intentional about self-care and seeking support and help when we need it will not only help us feel better, but will also help us to be more resilient in the face of these very stressful times. And stress management and self-care strategies can also help to boost our immune functioning. The college has developed a campus commitment, which reflects the idea that every member of our campus community must do their part to maintain the health and safety of the community by committing to do a number of things, including inclusion and patience, by avoiding discrimination and providing support, by regularly monitoring and practicing self-care, by engaging in prevention practices like wearing face coverings, practicing hand hygiene and respiratory etiquette, avoiding crowds, following social distance guidelines, discouraging unsafe behavior in others, and acting as an active bystander to create a safe community, providing notification to the college of things like positive test results of COVID and exposure, observing travel restrictions and quarantine measures, and observing the space restrictions that have been put into place. It's also very important that people participate in contact tracing efforts when requested to do so. Hopefully, this module has provided you with information that will help you move through the coming weeks and months. As you go forward, please remember that there are many resources available on campus to answer questions and to support you. For the most up-to-date COVID-19 information, visit the coronavirus webpage on the Colorado College website. You can email the COVID-19 email with pandemic-related questions. Campus Safety is our most easily accessible 24/7 resource, and they can connect you to other round-the-clock resources like the Counselor on Call and the Sexual Assault Response Coordinator Advocate on Call. Maggie Santos, our Director of Campus Safety, is serving as our COVID point person, so you can email her to report travel, illness, or test results. Students can access healthcare through the Student Health Center, where both in-person and telehealth services are available. The Counseling Center will be primarily offering counseling sessions via telehealth platforms, and students can make appointments by emailing or calling. They can also reach a mental health provider after hours by calling the Counseling Center and dialing 2. Staff and faculty can access counseling through the EAP, or Employee Assistance Program. All members of the community can reach Chaplain Kate Holbrook for support. And you can also find information about support resources on campus and across the country through this Life at CC support resources for students and through the Wellness Resource Center webpage. Thank you for participating in this module. Now all you have to do is take a short quiz and you'll be done. You can also return to this module whenever you need to remind yourself about the information provided here. Thanks very much.